The journey to parenthood, for so many people, it's just not as simple as they thought it would be. It can be this really quiet, lonely struggle, right? Filled with so many questions and, honestly, a lot of bad information. So in this explainer, we're going to cut right through all that noise. We're going to replace the myths with cold, hard, clinical facts, straight from the experts.
Okay, so first things first, it is so important to get this. If you're going through this, you are so far from being alone. This isn't some kind of personal challenge you have to face by yourself. It's a global medical reality.
All right, so just how big of a deal is this? Well, check out this number. The World Health Organization says that 1 in every 6 people around the world will experience infertility at some point. 1 in 6. I mean, a number that huge, it just completely changes the conversation, doesn't it? It pulls this topic right out of the shadows and puts it squarely into the mainstream of public health. And that quote right there, it really gets to the heart of what we're talking about. Infertility is not a lack of willpower. It's not a personal failure. It is a complex medical condition. And it needs real science-backed solutions, not judgment. So, with that in mind, let's just jump right in and start busting some of the biggest myths out there. All right, first up, let's tackle a huge misconception. And honestly, this is one that has caused so much pain and has literally stopped people from getting the right treatment for generations. You know, for centuries, society has kind of pointed the finger, putting the entire weight of infertility on women. It's an idea that's so deeply baked into our culture. But here's the thing, it's just flat out wrong. Scientifically, demonstrably, completely false. So you can see it right there, myth versus fact. And the difference is just night and day. The myth is simple, and it's wrong. The fact, the scientific reality is that infertility is a totally equal opportunity medical condition. Let's look at the actual data that proves it. And the data couldn't be clearer. Look at this. Research from the Mayo Clinic shows a nearly perfect 3-way split when it comes to the causes. About a third of the time, it's related to male factors. Another third, female factors. And that last third is either a mix of both, or the cause just isn't clear. So what's the big takeaway here? It's simple, but it's absolutely crucial. You have to do comprehensive testing for both partners, right from the very beginning. Okay, let's move on to the next myth. And this one, oh man, this might be the most common. And let's be honest, the most unhelpful piece of advice that people get when they're struggling. I bet you've heard this one before. Maybe you've even said it, probably with the best intentions. But think about what that advice actually implies. It suggests that infertility is all in your head, that it's a psychological problem you can fix with, I don't know, a trip to the beach or just by thinking differently. But the reality is, infertility is a physical thing. It's rooted in actual medical conditions. We're talking about things like PCOS, endometriosis, low sperm count. And yeah, of course, tons of stress isn't great for your health in general. But more often than not, that stress is a result of going through the incredibly tough journey of infertility, not the cause of it. I mean, this quote from the CDC just says it all, right? Relaxing isn't going to unblock a fallopian tube. It's not going to fix a low sperm count. You can't just meditate your way past a real physical blockage or a hormonal problem. These are clinical issues, and they need medical solutions. All right, next myth. This is a big one you see in movies and magazines all the time. It creates a ton of anxiety for some people, but funnily enough, it can also give younger folks a totally false sense of security. Yeah, this idea is everywhere, isn't it? The notion that the second you turn 35, some kind of biological alarm goes off and your fertility just falls off a cliff. It makes for a good story, for sure, but it's just not how it works. The truth is a lot more subtle. Think of it less like a cliff and more like a gradual slope. And what's really important to remember is that this slope can be affected by other health conditions at literally any age. So even in your 20s, things like PCOS or endometriosis can be part of the picture. Now, does the decline get steeper after 35? Yes, it does. But it's all part of one long continuous process. And hey,
This is not just a woman thing either. Male sperm quality also starts its own gradual decline after age 40. The bottom line is, fertility is something to think about as part of your overall health throughout your life.
Okay, but this brings up another question that people ask all the time, and it's a really good one. It's a real concern for a lot of people. So let's just tackle it head on. And the answer is a pretty straightforward no. The experts at the American College of Obstetricians and Gynecologists are clear on this. While birth control does its job preventing pregnancy, it doesn't cause any long-term infertility. For most women, your body's natural cycle gets back on track within just a few months after stopping. All right, we've busted some pretty big myths. So, what now? Where do you go from here? Well, the really good news is that science gives us a very clear step-by-step path forward.
It all starts with getting a clear picture through advanced diagnostic screening to figure out what's really going on. From there, you've got options. It could be hormonal management, maybe a less invasive procedure like IUI, which stands for intrauterine insemination, or it could be IVF, in vitro fertilization, which is really the gold standard for a lot of the more complex situations. The main thing to know is that there are real, science-backed, and super effective options out there. So, you see, just getting past all the bad information, that's the first and maybe the most powerful step you can take. It's really about taking back control of your own health story. Okay, so let's just quickly recap the big takeaways. Number 1, infertility is a common medical condition, not a personal failure. 2, it affects all genders equally. 3, just relaxing is not a medical treatment, it just ignores the science. 4, age is a gradual slope, not a sudden cliff. And maybe the most important point of all, there's hope. There are really effective, science-backed solutions that exist today. And that really brings us to the final question. And this one is for you. Now that you have the facts, what's your first step to get from the confusion of all these myths to the clarity of a real, science-backed plan? You know, maybe it's making an appointment with a specialist, maybe it's just starting a different kind of conversation with your partner. Whatever it is, that first step is yours to take.